What happens when a CEO goes undercover in his own healthcare company, only to uncover shocking negligence, corruption, and a system failing its patients? Welcome back, insightful viewers. Today, we dive into the eye-opening journey of Dr. Ethan Caldwell, who disguised himself as a patient to see the truth behind his medical clinics. What he found was alarming: overworked staff, careless doctors, and funds being siphoned away from patient care. But instead of walking away, he decided to take action. Stay with us as we unravel this gripping story of deception, confrontation, and the fight to rebuild trust in healthcare. Dr. Ethan Caldwell had spent decades building Caldwell Medical Clinics into one of the most trusted healthcare providers in the region. Known for its patient-first philosophy, affordable care, and highly trained staff, the clinic network had grown from a single neighborhood practice into a chain of state-of-the-art medical centers. Ethan had always believed in running a company that put ethics before profit, ensuring that every patient received quality care regardless of their background or financial status. But recently, troubling reports have started to surface. Patients at one of the clinics had begun complaining about long wait times, rude staff, and rushed medical care. Some claimed they were being charged for unnecessary tests, while others reported being misdiagnosed or ignored by doctors. Worse, a handful of former employees had anonymously leaked concerns about overworked nurses, cost-cutting measures that compromised patient safety, and a toxic work culture. Ethan brought up these concerns at a board meeting, but the senior executives dismissed them, blaming demand fluctuations and temporary staffing shortages. Ethan, however, trusted his instincts, and his instincts told him something was seriously wrong. He had built this company on the foundation of care and integrity, and if his clinics were failing their patients, then he had failed too. The only way to find out the truth was to see it for himself. Instead of relying on reports and corporate meetings, Ethan made a bold decision. He would go undercover as a patient in one of his own clinics. With a fake medical file, a new name, and a simple disguise, he prepared to walk through the doors of his own clinic, not as the CEO, but as an ordinary patient seeking care. What he would soon uncover was far worse than he had imagined. A system that had drifted from its core values, where profits were prioritized over lives. And Ethan wasn't about to let that continue. Dressed in plain clothes, with a forged medical file listing mild but persistent symptoms, Dr. Ethan Caldwell stepped into one of his own clinics, not as the CEO, but as an ordinary patient named Eric Dawson. The waiting area was crowded, filled with people clutching forms, sighing in frustration, and shifting uncomfortably in stiff chairs. The clinic had once been known for its efficiency and compassionate care, but what Ethan saw was chaos. The reception desk was cluttered with paperwork, and the staff behind the counter barely looked up as patients approached. Ethan walked to the receptionist, a woman in her mid-30s who looked utterly exhausted. "Excuse me," he said, keeping his voice calm. "I have an appointment." She barely glanced at him before muttering, "Fill this out and wait to be called," sliding a clipboard across the counter before immediately returning to typing on her computer. No greeting, no eye contact, no explanation. Ethan filled out the forms and took a seat, observing the staff's behavior. A nurse at the counter rolled her eyes at an elderly patient struggling to explain her symptoms, while another employee laughed with a coworker, ignoring a mother trying to get help for her sick child. Minutes turned into an hour, then two. Ethan's name was never called. He watched as patients who had arrived after him were seen first, including a man who had loudly complained to the staff about the wait. When he finally approached the desk again to ask about his appointment, the receptionist let out an annoyed sigh. "We're busy. If you don't like waiting, find another clinic." Ethan clenched his jaw. This wasn't just inefficiency. This was blatant disregard for the very people the clinic was meant to serve. Finally, after another agonizing wait, a nurse reluctantly called his name. Instead of guiding him kindly, she barely glanced at him and motioned for him to follow with a careless wave of her hand. The consultation room was cluttered, the medical bed covered with old paper sheets that hadn't been changed. Then came the real shock. The doctor spent less than 5 minutes with him. She barely listened to his symptoms, interrupted him mid-sentence, and immediately recommended a series of expensive tests without explaining why. When he asked questions, she grew irritated. "Do you want treatment or not?" she snapped. Ethan left the clinic frustrated, disappointed, and furious. This wasn't just bad service. This was neglect, and it was happening under his name. Something had to change immediately. As Ethan Caldwell continued his undercover visit at the clinic, what he witnessed next shook him to the core. The careless attitude he experienced at the front desk and in his rushed consultation wasn't just an isolated incident. It was part of a systemic problem plaguing his healthcare empire. Sitting in the waiting area after his appointment, Ethan quietly observed how the clinic operated. A nurse wheeled in an elderly woman for her routine checkup, but left her unattended near the restroom, where she struggled to balance herself. No one helped her until another patient stepped in. A few feet away, a medical assistant mixed up patient charts, mistakenly calling in the wrong person for a procedure. The patient, confused but trusting the clinic staff, almost received a treatment meant for someone else, a mistake that could have had serious medical consequences. Ethan's stomach twisted as he realized just how dangerous this negligence could be. Then, an alarming scene unfolded before him. A young child no older than 5 sat in his mother's lap, crying from a high fever. The mother desperately tried to get the attention of the staff, but the receptionist dismissed her, telling her to wait her turn. Ethan watched in horror as the child's breathing grew labored, yet no one seemed to care. The nurses stood behind the counter, chatting amongst themselves about weekend plans, while patients grew more agitated. This wasn't just inefficiency, this was putting lives at risk. Wanting to understand more, Ethan approached a janitor who was wiping down a counter. Speaking quietly, the janitor shook his head and said, "This place used to be better, but ever since they cut back on staff, everything's rushed. The doctors barely have time, the nurses are overwhelmed, and the managers only care about numbers." Ethan's heart sank. So this was the result of the cost-cutting measures that his executives had convinced him were necessary. Instead of improving efficiency, they had made things worse. Employees were overworked, and patients were suffering. The breaking point came when he overheard 2 nurses joking about a patient who had passed out in the hallway the week before. Instead of concern, they laughed about how the incident wasn't their problem. Ethan's fists clenched. If this was happening in one clinic, how many others were just as broken? He had come undercover hoping to find minor inefficiencies. Instead, he had uncovered a crisis. Now, he had only one question left. How deep did this neglect go? Amidst the neglect and incompetence, Ethan Caldwell finally found a glimmer of hope. A single dedicated worker who still upheld the values his healthcare empire was supposed to represent. As he continued to observe the clinic, he noticed a young nurse, Isla Ramirez, moving tirelessly between patients. Unlike the others who seemed uninterested or overwhelmed, Isla remained focused and compassionate, taking time to reassure each person she attended to. Ethan first noticed her when a frail elderly man was struggling to fill out his paperwork. While the front desk ignored him, Isla knelt beside him, patiently guiding him through each section. She didn't rush. She didn't sigh in frustration. She treated him with respect. A few minutes later, when a diabetic patient grew dizzy in the waiting room, it was Isla who immediately sprang into action. She guided him to his seat, checked his blood sugar, and called for assistance, while other staff continued their conversations, as if nothing had happened. What struck Ethan the most was when Isla noticed the feverish child who had been ignored earlier. She walked over to the distressed mother, checked the child's vitals, and immediately took them to an exam room, bypassing the dismissive receptionist without a second thought. It was clear she was doing everything in her power to provide proper care, even in a clinic that had seemingly given up on its own patients. Wanting to learn more, Ethan approached her under the guise of a concerned patient. In their brief conversation, he could hear the exhaustion in her voice, but also the determination. "I know things aren't great here," Isla admitted, glancing around as if making sure no one else was listening. "But patients still need us. If I don't step up, who will?" Her words hit Ethan harder than he expected. In a system that had abandoned its principles, Isla was one of the last people still fighting to do the right thing. But how much longer could she keep going in an environment that refused to support her? Ethan knew one thing for sure: people like Isla deserved better, and he was going to make sure they got it. Ethan Caldwell had already seen the neglect, the incompetence, and the lack of compassion in his own clinic, But what he discovered next was even worse. A massive cover-up that explained exactly why the facility was falling apart. Determined to understand how a once thriving healthcare center had become so dysfunctional, Ethan began asking subtle questions as Edward Carter, his undercover identity. Staff members grumbled about pay cuts and budget restrictions, despite the clinic still charging premium fees for its services. Equipment was outdated, basic supplies were running low, and overtime was going unpaid. Yet according to financial reports he had reviewed before going undercover, this location was still turning a healthy profit. So where was all the money going? His answer came when he overheard two senior administrators, Martin Reeves, the clinic director, and Lisa Caldwell, the financial manager, chatting in hushed voices in the hallway. They weren't discussing patient care or improving conditions. Instead, they were laughing about their latest business trip, which, from what Ethan could gather, had been an extravagant getaway at a luxury resort. "The board will sign off on anything," Reeves chuckled, "as long as we label it strategic planning or staff development. They don't ask questions." Ethan's stomach churned. The money meant for improving patient care, paying overworked staff, and maintaining the clinic was instead being funneled into executive perks, bloated administrative salaries, and unnecessary conferences in high-end locations. The real shock came when he sneaked a look at a staff memo left on the front desk. It revealed that the clinic had quietly cut funding for medical supplies and reduced nursing shifts to streamline operations, all while upper management approved a 15% increase in their own bonuses. Even worse, patients were unknowingly footing the bill for this corruption. Ethan overheard billing staff being instructed to push unnecessary tests and procedures on insured patients, while dismissing uninsured ones as not a priority. The system was built to squeeze as much money as possible while delivering the bare minimum in actual care. Ethan clenched his fists. This wasn't just inefficiency, this was deliberate greed, disguised under layers of corporate deception. His own executives had turned healthcare into a personal cash machine, exploiting both employees and patients alike. It was no longer just about fixing the clinic, it was about exposing the corruption that was rotting it from the inside out. Ethan Caldwell knew that confronting the corruption at his clinic required more than just his word. He needed undeniable proof. He had already witnessed the neglect, the incompetence, and the financial mismanagement firsthand. Now, it was time to gather concrete evidence that could expose the executives who had been draining resources for their own gain. Under his undercover identity as Edward Carter, Ethan began documenting everything. He discreetly recorded conversations where senior administrators openly discussed budget cuts, fraudulent billing practices, and unnecessary procedures designed to milk insurance companies. He took photos of critical supply shortages, empty storage rooms where there should have been vital medications, malfunctioning equipment left unrepaired due to budget constraints, and employee schedules that revealed dangerously understaffed shifts. His most damning piece of evidence came when he managed to access internal emails from an unintended computer at the front desk. One thread, sent between the financial manager Lisa Caldwell and the clinic director Martin Reeves, openly discussed how they were shifting patient care funds into executive discretionary budgets without the board's approval. Another email revealed how they planned to cut nursing staff even further to make room for administrative bonuses in the next quarter. As he pieced everything together, Ethan realized the depth of the betrayal. Not only were these executives sacrificing patient safety for personal luxury, but they were also manipulating financial reports to cover their tracks. Employees who complained were quietly let go, and any patient who pushed back against questionable charges was simply dismissed as a problematic case. But Ethan wasn't just gathering evidence for himself. He was preparing to bring down an entire corrupt system. With a hidden folder full of recordings, emails, photos, and financial documents, he had everything he needed to confront the clinic's leadership. Now it was time to step out of the shadows and force them to answer for what they had done. Ethan was done watching from the sidelines. He was ready to take his company back. Ethan Caldwell had spent weeks undercover, witnessing the neglect, incompetence, and corruption festering within his own healthcare facility. Now, standing at the front of the clinic's main conference room in his true identity as the CEO, he was ready to expose the truth. Across from him sat Martin Reeves, the clinic director, Lisa Caldwell, the financial manager, and a handful of senior administrators, all of whom had no idea they had been under surveillance. Surrounding them were doctors, nurses, and support staff, many of whom had unknowingly been caught in the fallout of the executive's greed. The room was tense as Ethan placed a thick folder of documents onto the conference table and pulled out a tablet. Without a word, he pressed play. A recording filled the room. "We're reallocating patient care funds to cover discretionary bonuses. The staff will adjust. If they don't, we'll cut hours until they do." Gasps filled the room. Lisa's face went pale and Martin shifted uncomfortably in his chair. Before they could protest, Ethan continued, "That was your voice, Martin. And here's the email where Lisa suggested cutting more nurses to balance executive bonuses." A projector flickered to life, displaying damning screenshots of financial records showing how patient care budgets were being siphoned away, photos of expired medications sitting in storage rooms, and lists of employees forced to work double shifts under extreme conditions. Ethan's voice was steady, but there was no mistaking the anger beneath it. "I built this clinic to help people, not to line the pockets of a few executives while patients suffer and staff are pushed to exhaustion." Martin finally found his voice. "This is taken out of context. Running a clinic is complicated and we had to make tough financial decisions." Ethan's glare hardened. "Tough financial decisions don't involve forcing nurses to cover for missing doctors, ignoring equipment failures, or charging patients for treatments they didn't need. This wasn't budgeting, it was greed, and it ends today." The staff in the room murmured in disbelief, some shaking their heads, others looking furious. Ethan had ripped the curtain away, exposing everything. Finally, he turned to the employees who had suffered under this mismanagement. "For too long, this clinic has been run by people who don't care about the patients or the staff. That changes now. There will be consequences for those responsible, and I will make sure we rebuild this place the right way." The room fell silent, the weight of Ethan's words settling over everyone. Change was no longer just a promise. It had become a certainty. With the corruption exposed and the worst offenders removed, Ethan Caldwell wasted no time in taking action to rebuild the clinic from the ground up. The first step was firing Martin Reeves and Lisa Caldwell, along with any other executives who had played a role in the financial mismanagement. Their replacements weren't just corporate hires. Ethan ensured that new leadership included medical professionals who actually understood patient care and valued the well-being of both staff and patients over profits. Next came restoring proper staffing levels. Ethan reinstated positions that had been cut, bringing back doctors, nurses, and support staff who had either quit in frustration or been pushed out due to budget cuts. He implemented a strict, fair scheduling system to ensure no one was overworked or forced into unsafe double shifts. Pay adjustments were made so that every employee was fairly compensated, and performance evaluations shifted from financial quotas to quality of care. The physical condition of the clinic also needed attention. Outdated medical equipment was replaced, expired medications were properly disposed of, and supply orders were no longer dictated by cost-cutting measures, but by patient needs. To reassure the community, Ethan invited independent health auditors to inspect the facility, proving that the clinic was committed to true reform. However, the biggest challenge was restoring trust, both among the staff and the patients. Ethan held an open forum, allowing employees to voice their concerns without fear of retaliation. For the first time in years, workers felt heard. He also personally met with longtime patients, assuring them that the days of rushed treatments, unnecessary charges, and dismissive care were over. Slowly but surely, the clinic began to change. The energy in the halls was different, lighter, hopeful. Nurses weren't racing against impossible schedules, doctors had time to properly assess patients, and the front desk no longer treated people as numbers on a balance sheet. Ethan had set out to restore his clinic's integrity, and though the work was far from over, he knew one thing for certain: Westvale Medical was finally becoming the healthcare facility he had always envisioned. 6 months after the scandal rocked Caldwell Medical Clinics, the transformation was undeniable. What had once been a broken system plagued by greed, neglect, and incompetence was now a revitalized healthcare facility committed to patient care and ethical practices. Ethan Caldwell had taken a failing institution and turned it into a beacon of hope, not just for the staff, but for the entire community. One of the most significant changes was the new leadership structure. Ethan had appointed Dr. Amelia Rhodes, a highly respected physician with years of experience in patient advocacy, as the new chief medical director. Under her leadership, medical ethics were prioritized over financial incentives, ensuring that no patient was ever turned away due to cost-cutting measures. Alongside her, a new board of directors was assembled, including medical professionals, patient advocates, and financial experts committed to transparency. Patient care had also undergone a complete overhaul. Wait times were reduced, and patient satisfaction surveys became a key metric for evaluating the clinic's success. The billing system was restructured, eliminating hidden fees and unnecessary charges, making healthcare more affordable and accessible. Community outreach programs were launched, including free wellness checkups for low-income families, and partnerships with local schools to provide health education. The changes weren't just internal. Word spread quickly about the clinic's revival, and soon patients who had once sworn off Caldwell Medical returned, bringing their families and friends with them. The staff, once exhausted and disillusioned, now worked with renewed purpose, knowing that their efforts were truly making a difference. Most importantly, the toxic culture that had taken root under the previous leadership had been completely eradicated. Employees were encouraged to speak up without fear of retaliation, and a zero-tolerance policy for corruption and mistreatment was strictly enforced. Ethan made it clear the clinic's success wasn't just about financial growth. It was about upholding the values of care, respect, and community service. As Ethan walked through the now bustling hallways of Caldwell Medical Clinics, he felt something he hadn't in a long time: pride. This wasn't just a business anymore. It was a place of healing, trust, and true medical care. The road had been difficult, but in the end the lesson was clear. Real success isn't measured by profit margins. It's measured by the lives you change for the better. The transformation of Caldwell Medical Clinics offers a profound lesson about the true essence of leadership and the importance of ethical practices in business. When Dr. Ethan Caldwell, the CEO, went undercover, he discovered that beneath the veneer of success, his organization was crumbling under a toxic culture driven by greed and negligence. The experience revealed that prioritizing profits over people not only endangers the well-being of employees and patients, but also erodes the very trust that is essential for long-term success. Real leadership means being willing to confront uncomfortable truths, take responsibility, and implement change, even when it means dismantling deeply ingrained systems. Caldwell's bold actions to expose corruption, reinstate ethical standards, and rebuild a culture of respect and accountability remind us that a company's value lies not in its financial gains alone, but in the care it shows for its community. Ultimately, this story underscores that lasting success is achieved when leaders are committed to integrity, transparency, and the genuine welfare of those they serve.